Thank
So,
you.
welcome everyone to this wonderful event and an interview with McKenzie DiStefano, who is a doctor of physical therapy. I'm sorry, Dr. DiStefano,
Yeah.
uh, who is here with us. So I'll let you introduce yourself, your practice, and a little bit about your history and professional narrative.
Okay, so I'm Mackenzie. I've been a physical therapist for over 10 years. I kind of have specialized in more of the vestibular rehab, gait imbalance, and more recently in the last 4 or 5 years, kind of that EDS FND population. Um, I own a really small clinic. It's just me outside of Boston. And I guess I find my passion in treating the more difficult cases that people, other PTs tend to kind of pass on.
Yeah, yeah. Thank you again for this, and it's so hard to find a specialist, right? Like, our profession almost calls us to be a generalist. We kind of have to be jacks of all
Mhm.
trades. So, what was like, the roadmap, and what was the trajectory that led you to this specialization? So we spoke a little bit about EDS and the connective tissue disorders, but what about the vestibular disorders? What got you interested in it, and what made you specialize in it?
Yeah. So I actually went to undergrad at Gordon College up in Wenham, Massachusetts, and they have a clinic there that just treats vestibular and gait imbalance. So I interned there as a student and kind of got used with seeing what vestibular therapy was. I went to grad school and did a clinical at a clinic that treated a lot of vestibular therapy, and then went actually back to Gordon College and worked there for almost 10 years. Um, so that's kind of how I fell into the vestibular world. And then from there, it kind of just grew
Mhm.
based on like the population I was seeing.
Yeah, and it's definitely a population in need. So I think what you're doing, people are willing to travel, and I think it's so hard to find a professional that knows how to treat it. So like it's definitely great that you were able to go off on your own. What are some of the best things you have learned in the last year of owning your own practice? So what are some of the day one learnings, and what are some of the year one learnings?
um, I guess day one and even year one, and I guess up until today, is kind of go with the flow.
Yeah.
Kind of whatever the day brings. I find that as especially with a more medically complex population, you can go in with any type of plan and it changes minute to minute. And I think owning a business is kind of the same thing. I'm kind of more of a type A person that likes a plan. So that's been a learning of like, nope, just kind of go with the flow, have your generalized plan and just make it work. Um, I think, when it comes more from documentation and EMR perspective, I think for me, the biggest thing was getting used to doing all of it myself. So doing the billing, doing the authorization. I've always worked with EMRs, even when I was at Gordon, but not so much the insurance and the billing side. So that was an eye opener.
Yeah, and there really is a lot of complexity, right? So, what, uh, I guess, how do you manage this complexity, like in dealing with different payers, dealing with different providers, especially with EDS, right? Like you have a large pediatric cohort, so there's some complexity there. So, what are some of the ways you're dealing with this complexity?
Well, one is I don't take a lot of insurances, unfortunately, just because it is too complicated and a lot of them don't reimburse the way I would need to be to stay open. So one of it is I do take a small amount of insurances, and that's actually one of the reasons why I ended up with Spry as part of my EMR system. I had tried a couple others before, and I just felt like I was either going to have to hire someone to do this role or to find a system that kind of had all of it in it. And that's one of the reasons, like I said, I kind of landed on Spry because you guys do in-house billing as well as authorization, which for me has been tremendously helpful because I don't have to worry about that, nor do I have to necessarily pay someone extra to do it.
Yeah, and so like I guess we can go a little bit deeper into this, but what were some of the challenges before with this prior authorization and some of these things, and how does it feel when an external agency is able to offload some of that from you?
Yeah, so the first EMR I used, I wasn't taking any insurance except Medicare, so that was easy for me to manage. And then when I switched to the second EMR, I started to take more insurances, and I was running into the issue of like, okay, I could do the billing, that was easy submitting it. It was more any errors that came back. And I kept running into like no one could give me answers. So if I called the billing team, they're like, well, we aren't allowed to direct you on how to bill. Or if I call the insurance, they're like, well, we can't tell you how to bill. I'm like, I don't need help how to bill. I just don't know why you're
Mhm,
denying me.
mhm,
So that kind of led me to like, okay, I don't have enough time in the day. And that's kind of where Spry came in, where now I don't have to worry about that.
mhm.
You guys handle all of that, and then I just keep an eye on it. And if I find any errors, which happen in life, right, then I'm able to kind of reach out. And I think one thing I've noticed about Spry is just how easy it's to communicate with you guys, especially using Slack, and how fast I usually get a response if there is any type of issues.
Yeah, and the communication is key, right? Like, and if you can communicate, if you can get a response, I think it's makes your life easier. Um, w- if we go back into your clinical practice, what are some of the biggest challenges that you see, not even yourself as a private practice owner, but that you see most private practice owners are facing, and how can these challenges be overcome with these systematic efficiencies, right? Like the billing. So, like, what are the challenges beyond billing that you're facing, and what can we do to make them better?
Yeah, I mean, I think, you know, time, right? Documentation time. Again, I had mentioned authorization. I mean, there's so many other things that can't even be taken care of with an EMR system, right? Just like billing
Like,
and reimbursement in general. But I think that, a lot of the things, like I said, I've always used an EMR system, so I've always been thankful to have that accessibility. Um, but what I'm really finding actually just this year is how important AI has become. Um,
mhm,
and how much time that saves me.
mhm.
So not having to write everything down and having my note pretty much done by the end of the session has been really helpful.
For sure, right? And if you think about it, we like, especially in a fee-for-service model, we're capped by the amount of hours we have in the day. And if we have to spend that
Hmm.
time with administrative work, then we don't have that time to spend with patients, and that's how we generate revenue. So then,
Right.
right,
And it's
like so,
it's interesting. I'm actually dyslexic, so writing and spelling has never been my gift. And I didn't realize how much of a mental load it had until I
mhm,
started using AI. And then since then, I have so much more mental capacity for my patients.
mhm.
So that's been amazing too, of not even realizing how much it was taking out of me mentally and how that impacted my patient care. And to just like remove that has been
Mhm.
like, I don't know, world changing for me personally.
Well, absolutely, right. And if you think about it, like, so some of these efficiencies that are built into these smart EMR systems, like traditional setting, you always have a wall between you and the patient. That's your computer, right? And so at least half the time you're documenting instead of having a conversation. Smart systems liberate you from that. You don't have to have a computer. You can have a scribe taking care, so you can have.
Hmm.
So, have you seen or patients reflect in it that it's so nice that I can talk to you instead of seeing you facing a computer and just typing away? Or have you noticed any of this?
Um, Not too much in my setting. I see patients one on one for an hour. So
Mhm.
even if I was typing before, I feel like they got a lot of FaceTime anyways. I mean, I put it in my onboard, like the patient's onboarding that I use it, and then I'll usually introduce, like, say I'm using an AI Scribe, but I get more questions about like what is it, how does it work, and then
Mhm.
they don't really care, and it's never mentioned again.
No, for sure, right? Like once you take out the mystery, then it becomes a norm.
Yeah, and
Um,
I we're seeing it more and more through other providers too. So I think patients are becoming more and more like it's just a common thing,
mm,
right? It's just the norm now versus the abnormal.
mm, absolutely. So, like, let's go into a little bit of a time machine. So, if these are the technologies that are available to us now, in the ideal world, what are some of the other technologies would you want available to you in the next year, 2 or 3, that will further help you? Like if you, in an ideal world where you have no limitations and no constraints.
Huh. I mean, I feel like I don't even know to start with that. I think like maybe creating like a follow-up like note for the
Mhm.
patient, right? So and AI can kind of do that, but like
Mhm.
having it built into the system where it's like, oh yeah, here's a summary that you can send your patient. Um, I think it's hard for me to even imagine just because it's hitting a lot of my boxes right now, if that makes sense.
Yeah.
Um, I could see like, and it's already happening, right? There's virtual assistants and they're going to become AI assistants where they're calling patients and giving callbacks. Um, I'm not ready for that yet because I still like, I call all my patients personally.
Mhm.
But for those bigger clinics, I think that would be huge of to taking almost like the front desk staff load off, right? So you almost don't even need as much of that front staff help.
Yeah, figure out the onboarding logic, right? Like so that you take away any friction point from people finding you. How do you think if technology was able to actually help you become more discoverable? And like it's like as a specialist, right? Like you have such a gift to give to patients, but not everybody can even know you exist, right? Like so, how have you like what are some of the marketing strategies that you have used to promote your practice? And if you have to share this with other practice owners, like what are some of the good things to do and what are some of the things you learned?
Yeah, so I think for me, the biggest thing has been kind of like the EDS has an Echo, like international page that if you're a provider, you can be listed on. Same thing with FND.
Mhm.
So actually, that has been really helpful. So people with these rare conditions tend to go and look for support. The other big one, at least for my practice, has been more of word of mouth in these Facebook subspecialty groups because
Mhm.
all the patients talk to each other, especially when they have more of a rare diagnosis. I also use a lot of social media. I haven't found a ton of luck with advertising to physicians. I find that it's coming more from like the patients doing their own research and kind of looking.
Yeah, you
And
are
there's like,
building your community, right? So
yeah. And I mean, if you go on to these specialty, like you look up and there's like 5 people in Massachusetts. So there's not a big list to pull from.
how like what are some of the other uh, ways or things that having a system can help you build a stronger community? So like are you taking a systematic approach? So being a part of your EDS community, being a part of the vestibular hyperfunction community, like how can these smart systems help enhance that?
That's a good question. I'm sure there's a lot of ways that it can help. I just don't know. I see it more in my head, like more of a social media thing, right? Like, is it advertising? You know what I mean? Having um, databases where people can go and look up different specialties, which I think they all exist, but like, how do we pool it all together?
Mhm.
um, and then I know Google reviews, it can be really helpful. So, like building that into the system where those reviews, like that link is sent out by the EMR, it could be really helpful too.
Yeah, and I think every patient is potentially your evangelist. It's your like you can use your patients as your champions, right? They are your community.
Yeah, yeah. So a lot of those reviews, unless I think like that I had mentioned, I asked one patient, like, well, how did you even find me? And she's like, oh, well, your name's getting around in the support groups on Facebook. So
Mhm.
I'm like, oh, okay. good to
Yeah.
good to know.
So
Um,
how do you think we can amplify some of this that like and like if it's already on Facebook and support groups, do you think there's a way to make it resonate more?
I mean, well, I would guess would be like, what do you guys have for ideas?
Yeah.
Um,
So there's a tool. So we at Spry released a tool that we're offering to all of the providers, even not our customers, because we think that the social aspect of getting the promotion of our business is so important. So there's a tool that can optimize some of this social media. deliverables, which can create a specific architecture for patients to review your business, review your practice through different platforms, through Google, through Yelp, through and so I think having these instruments like located in one spot is so important, especially when you are starting your practice, because it's a big, like you only have 24 hours a day, right? And if you're running a practice and you're a mom and you're a busy professional, then like so you want the technology to offload some of that responsibility off of you, so people can review you, especially when you're doing a spectacular job, right? So I
Yeah.
think that's like that is a tool that's available. So I want to go a little bit into your workflow and into your typical day. So you see patients for an hour. You provide a lot of undivided attention. Take us through your typical day before you found a system that helped you, like so with some of the other systems you've tried, and how that created friction points, and how were those friction points solved by a smart system.
Yeah, so I think a lot of it, like I had mentioned before, I don't take advantage of like the scheduling, like a patient being able to schedule themselves. But I know that that's been really helpful for other clinicians. For me personally, it's been, you know, again, that billing. So pulling up and knowing the patient has the authorization they need, and if they don't, knowing who I contact to ask to make sure that's looked into, knowing what their copayment is or their coinsurance for billing. Um, and then, like I said, for me, the biggest thing is, all I do is hit record when I'm with a patient, and
Mhm.
then I stop the record and I edit my note based on kind of what was presented in front of me. So, and then I move on to the next patient. So by the end of the day, there's not too much left for me from a paperwork standpoint to do, which is super helpful, which then allows more time for me to like answer questions. I have patients emailing me, texting me throughout the day, and I do try to get back to them by the end of the day. So,
Have you noticed it democratized and liberated some of your personal time as well? Like you have more time at home if you don't have to sit and do notes?
um, yes, I don't. In the past, I would take notes and just do them after my kids got home or were in bed, actually, or get up early and do them. So that has definitely helped that. Um, that was a bigger issue, I think, at my past job. Now I kind of have it, so I manage my schedule, so I'm not taking stuff home. But again, this just allows me more time at the end of the day to get some of those other things done, as well as like looking into any questions I have or continue education. So kind of all of those things. It's definitely given me back time. The other feature I really like is also like the plan of care. So when that comes in, like the smart system just reads it and then assigns it, and I just hit OK. So I don't have to go in and do anything. It just links everything, which is really helpful.
Yeah, I think that's what technology is actually good at, right? Is reading large chunks of data and analyzing it. Have you had a chance then to use some of the business analytic features of the platform? And can you reflect on it a little?
A little bit. I feel like because it's only been a year, I think it's almost a year now that I've been using Spry, and it's almost a little over a year that I've been in this facility. So it's been almost perfect timing for me to start looking at like the year in review and just looking at visit numbers, reimbursement numbers. So I do think that's going to be even more helpful as I go on, but just have started utilizing it just because it's been so new.
Yeah, and especially from 12 years in practice, right? You see how seasonal our practice is. There's ebbs and
Yeah.
flows, right?
Yes.
So
Yeah.
having a system that can help you anticipate it, then you can become proactive, not reactive, right? That's
Yeah. And I think that will continue to, like, for me, like, because it was the first year, I'm like, okay, let's see if those patterns are the same this year or are they different?
Mhm.
And kind of like what's going to happen.
And that's so awesome, right? Because like being reactive, traditional. I'm a PT, so I know that entire cycle of like if January hits and then all of a sudden you don't know what to do because your clinic is slowing down, and then June hits and you don't know what to do because you don't know how to find time in the day to see all the patients. I
Right.
think having smart systems, like you're already seeing the trends and the systems alarm you to trends. So if you see a reimbursement going down, you're being proactive about it. If you're seeing patient volume going down, you're being proactive about it. So I think that's really wonderful. So a little bit more on the patient complexity side. So vestibular system, right? It's a complex system
Hmm.
with a lot of different comorbidities playing into it. And there's a primary vestibular hyperfunction, but then there's also all of these secondary vestibular disorders that can manifest themselves. So have you found the ability to maintain efficient documentation helpful in providing a more precise clinical care? And is there a point where these systems can get even better in the future to help you with clinical precision?
Yeah, I'm finding with AI, it's better if it has an open text box versus things to fill in. I came from like, I'm actually in the process of with you guys trying to change some of my documentation because I find when there's a lot of blanks to fill in, it can get confused and it will fill in things incorrectly or things I don't want to be filled in get filled in. So I'm finding that if I just have a blank box, it does a better job and then it kind of learns, right? So the more I document, the better it comes about documenting the way I like.
Yeah.
So by using certain terminology in my like in my evaluation, and then I'll go in and edit, and I find that it does learn pretty well, so that the next time I do an eval, I'm not having to make as many edits, if that makes sense.
Yeah, that's the smart system, right? Creating feedback loops that the system can
Yeah,
learn from. Um, uh, I think, like based on what you just said, then how important is it to have a partner in your business in the sense of from a tech side that works with you to adjust and to customize some of these templates so that the system actually works with you and for you instead of against you? Like, so do you think that I guess in a way, selfishly, do you think that having a spry product that they can like work with you and help you build a product that's applicable for you? Is that it? Like,
yeah.
that,
No, I think because I've worked with both ways, right? I've gone from a system where I had to build everything in it to a system where you guys do all of it. And I feel like personally there's a happy medium. I really appreciated that when I switched over to Spry, like you guys inputted all my old patients. Like there was hardly any work on my end, which was huge coming from doing that twice before. And that takes so much time. Um, and I would say that you guys are super fast at making changes, but I also think that almost to offload some of your work, right? If it's a simple change, sometimes I wish I could make it because it would save me and you time, if that makes sense. But on like a whole, I would say it's so much more helpful to have that person to communicate with, and in those big changes not have to spend the time to make them. um so I know it's like a 50-50.
always, always. I think that's right on, and I think it's like one of the biggest benefits to Spry, like and it is the fact that the entire system was built from therapist feedback. Like it's not a system that was built by engineers for engineers and then just thrust into therapist hands. From the foundation, I think that when Bridge, the founder and the CEO of Spry, started the company, his Magna Carta was to have the therapist design the system that works for the therapist, not the other way around. But I think it does take therapist feedback to help
Hmm.
engineers better understand some of the structure, some of the workflow, right? Because like I think
Yeah,
so it's always 50-50, and I think it should stay that way. And that's why the product is as well received by the therapist community, is because it's the therapist that built it in a way. So they're using engineers' hands to build a product that they can use.
yeah.
Um, so that's
And I
wonderful.
think
So
I
yeah,
Yeah, and I think therapists, like I had a discussion with my old coworkers because they don't use AI right now. And I know one of the questions was like, well, how do we have all these clicks and all these things we have to enter. And I think we went from like paper to then being able to really customize things. And now we're almost going backwards in the sense like, let's just have a blank blank page again and let AI fill it out for us based on like our communication and our treatment sessions, which I think is, really interesting and helpful.
yeah, we add by subtraction, right? Like so, you take away
Yeah.
complexity, you actually add complexity.
Right. Well,
Um,
and my notes are definitely more detailed.
mhm.
And sometimes they'll capture things that I was like, oh, I wouldn't even thought of that because it's with a conversation that I'm having with a patient. So,
Just like having a thought partner, right? Like the AI I think, is like an optimal thought partner that you can use.
mhm.
So
Yeah.
this is more of a personal question about the practice. So right now you're a solo practitioner. Do you
Mhm.
think this is a model you want to continue to practice going forward, or do you see yourself growing into a multi-practitioner practice in the future?
Um, so yes, I'd love to grow. My big plan per se or a thought is to eventually have an EDS clinic with a lot of different providers and disciplines. Um, but I try to rein myself in a little bit because I'm a mom of two young kids. So it's more about timing. So yes, I do see myself growing. I just don't know what that timeline looks like.
Yeah, for sure, right? Like, and it's a big step to go from one. Like the biggest step is going from 0 to 1, and the second biggest step is going from 1 to 2.
Yeah.
So, but then anything else is kind of easy. So, more on a personal side, I guess, and this is more of like because you're a physio. Do you think you chose this career, or do you think somehow the career just chose you, like to be the specialist and a professional? Like which way do you think it is? Do you think like you chose to be a physical therapist, but then at which point does a physical therapy actually reshape you as a mom, as a person, as a human?
Yeah. So I always knew I wanted to be in the medical field of some sort. And I kind of gravitated to physical therapy more because of all the one, like the time you get to spend with patients. Like you get to see them multiple visits. So that kind of brought me into the field. And then I think it's interesting. Like I said, my son, both my kids are hypermobile and neurodivergent. And that's kind of what really grew me into kind of specializing in that hypermobility population. But I've always been drawn more to these medically complex patients, even when I was at Gordon. I don't know why, but I find it really fulfilling to kind of get them feeling better and just kind of helping them through the process, as well as providing those resources. So, as a PT of a medically complex patient, usually PT is not the only specialty. So helping them navigate like what other people they need on their team to help them get better.
It takes a village, right? It takes a village to manage
Yeah,
EDS. So, and
yeah,
you're building a
yeah.
village. So,
Hopefully,
uh,
yes.
if you like this is a good medium for the dispersion of information. So, if there's one thing you would share about EDS that you would want other providers to know, what would it be? Especially the ones that are not specialized in EDS.
Yeah, I think the thing that has been hitting me the most is a lot of patients come to me saying that there's no help for EDS. There's nothing you can do for it, and you shouldn't do any exercise or heavy exercise. Um, and I would say that that's not true. There's a lot you can do for EDS, and exercise is a huge part of it. It's just kind of finding what the right exercise is for the right person. And from a provider side, I get a lot of patients coming and being like, I've tried PT, I've done all this, it doesn't help, they made it worse. And I guess my thought process on that is, for these individuals, they can do an exercise, but they don't usually recruit the right muscles. So it does take time and effort and a lot of questions to kind of figure out what they're doing and what they're not using versus what they are using from a muscle standpoint, and how do we give them the cues to use it correctly. And when that happens, I find that they do really well. And I have I know a lot of people with EDS that are marathon runners, and then I have a lot of people with EDS that have more significant symptoms, and it's really just trying to match what's going to be best for that person at their specific moment in time.
Yeah, you're the best advocate patients have because you understand them, and then you can like you form an alliance, and then it becomes you and the patient always, right? So
Yeah.
like you're the best resource, and I really hope that everyone in on the East Coast gets the chance to, especially with the need, will get a chance to meet you and actually become one of your patients if there's a need. I think that
Or join the team. I'm always
or join
looking
the
for
team,
people.
absolutely. And if not, I think there's a great way to form a network. So if hopefully if somebody's listening to this, now they'll be able to make a connection with you, and then be able to refer to you once, like once there's a need, right?
Right.
Now more on a selfish level, if you can, based on your experience with Spry, like, and somebody's on the fringe, right? So they're also a private practice owner. but they are not sure whether they should make a move. They have this old system they've been using for 20 years or 15 years. Uh, what are some of the things you would say that if they had to assess and take the three-step solution, how would they go into giving Spry a chance?
Yeah, I think it's being open for change. Because I've moved from different EMRs, there's always something you like and dislike about every system, right? There's no perfect system. Um, and it's kind of trying to figure out like what's going to work best for you and what's going to make life the most easiest for you, right? So for Spry, for me, it was the billing and the AI and the authorization that really made the biggest difference in saying, okay, yes, yeah, there might be things I don't love about it, right? That's like anything. But when I look at the whole picture, this has made my practice so much easier. So I think, one is being open to change and knowing that no transition's easy. So it might be painful in the beginning. But knowing that, like, again, another thing with Spry has been really great about is working through a lot of those changes. So when I first started with Spry, I had to change my documentation. We worked back and forth. It took a month or two before I had it the way I wanted to, or wanted it to run. And knowing that going into it is helpful because I think people they don't think about that. That's going to take time, right? And then it gets
Mhm.
frustrating. And I guess the last thing is that communication, right? So I think Spry is the only one I've used that has used Slack as a way of communicating, and I do find it much faster than even email. Even if it's just a response of, "Hey, we're looking into it. We'll get back to you." It's just helpful to know, like, okay, they're on it. I don't have to worry about it until I check back in.
Awesome. And I can tell you on the receiving end, being with Spry, there's always a person like on the other end of the Slack. There's always somebody standing by and listening 24 hours a day. So when you send a queue, somebody's there to listen and respond. You're not going to get a machine answer. You're going to get a human response. So before we wrap up, is there anything else you would want the audience to know about yourself, your practice, or just any parting words from you?
I mean, I guess it would be, as a profession in the medical, world, just to keep on plugging away and not give up because I feel like times are really tough right now. And I think using it, smart systems, EMR, AI is going to be the future. So it's kind of just finding the right one and knowing that it's going to continue to grow with you. Um, from a practice standpoint, I mean, again, I just would say be open to change and go with the flow.